bit light on this morning, but we'll plough on. I've been joined by Naomi Bromley, the Acting COVID Response Commander, and the Acting Chief Health Officer for today, Professor Ben Cowie. So thank you for coming. And just to highlight that Ben will be needed to disappear at 12:30 for AHPPC. There are currently reported today 7 locally acquired cases in this morning's numbers from yesterday, and 0 of those cases were from hotel quarantine. This brings us to some 205 active cases of COVID-19 currently in Victoria. We have 7 cases in hospital. This includes 2 in ICU, with 1 of those people being on a ventilator. Yesterday, through the state-run clinics, we distributed 19,118 vaccinations, and that was another strong day through our state clinics. And of course, a similar number was distributed through our GP and primary healthcare partners. We also returned 42,009 COVID tests yesterday. So that was a very strong figure, and I want to thank every one of those people for coming forward and getting tested, because every single test helps us through our public health team stay ahead of this, find those cases when they're out there, and gives our public health team the tools they need to keep us open and keep us safe. Even better, 99.2% of those results were returned by the next day, giving those people, those citizens, those people doing the right thing, the assurance that this will be turned around quickly when you get your test. And please, everyone who has even the most mild of symptoms, visit your local testing centre, get tested, stay at home until you get your results. You will get your result, as these show, the very next day, if not sooner. 6 of those 7 community cases that we've announced were in isolation during their entire infectious period. And of those 7 cases, 4 cases are students at Bacchus Marsh Grammar who were all in isolation, and all were obviously primary close contacts and actually tested on their day 13 test positive. A further 2 are household contacts of the previously identified case at the Lacrosse Apartments in Docklands. And the 7th is the person that we alerted the community to yesterday, the traffic controller who worked at the testing site at the Moonee Valley Racecourse. So they're the 7 cases. And what they obviously do is to highlight to us all that this virus is still with us, well and truly, and that our response needs to be based around the fact that this virus needs to be, in terms of the current strategy of active suppression, managed out of our system, and our need to keep following the rules is so important as part of this process. And we'll come back to that in a minute. Our public health team have conducted interviews with the traffic control person yesterday, and that has seen a number of exposure sites put up online yesterday. I urge everyone to check the website and get tested if you have been in those exposure sites at the dates and times listed. It's very important that you do so. And Naomi will provide more details about the public health response in this particular circumstance very shortly. As I said, the 4 new cases related to Bacchus Marsh Grammar were all in isolation and were primary close contacts, and were all tested on day 13, which led to their positive status being uncovered. And what that says is this is actually a timely reminder that cases with Delta variant turning positive at the end of isolation period is still a real thing, and makes it so important that the system of isolation of primary close contacts gets seen through to the end. it shows us that that day 13 test really does count. You need that day 13 test as a primary close contact before you leave isolation. You need a negative test from that day 13 test, and you need the clearance from the Department of Health. It's really pretty straightforward. No test, no release, and then you face a further 14 days in quarantining at home. My thanks again to the now 13,000 primary close contacts Victorians who are still isolating at home. That number continues to come down. It was over 20,000 a few days ago, but we've still got some very big numbers to clear from some of the very large events that have been caught up in this exposure episode. One of the primary close contacts in those 13,000 we had some difficulty locating, but I'm pleased to advise that one particular person has since been located, tested negative, and is being cared for in the hotel quarantine system. The overwhelming majority, by a country mile, the single biggest contribution that these 13,000 Victorians are making is to keeping us all safe, and so many of them are doing the right thing, and we will continue to work through as quickly and as timely as we can to get you tested, get your test result to you, have that confirmation process to get you cleared. We understand that you're nearly there, but please bear with us and we will get through clearing these many, many thousands of primary close contacts over the coming days. We also continue the program of Department of Health authorised officers visiting homes across Victoria to make sure that people are isolating and continue to do so until they are properly cleared. And we've been joined in that effort by a further 100 Victoria Police officers over the past few days, and I want to thank VicPol for their continued efforts in support for the health officials in making sure that we all follow these rules. Police can issue fines for quarantine breaches, but we are confident that that's not going to be necessary as the overwhelming majority of people continue to follow the rules. Yesterday we visited 1,147 people through that compliance process, and we will do a similar, if not larger, number today and in coming days. Overall, what we've seen over the past few weeks is the very best of Victorians. People who understand that to stay ahead of this virus means that we have to follow the public health rules to keep ourselves safe, to keep those we love safe, and to keep the community that we're all a part of safe. We see today another record day of infections in New South Wales. We don't have to think too far back to understand what our friends and family and colleagues in New South Wales are going through. We've been through that. These rules, these systems that are in place are designed to keep us safe and to keep us out of that similar pain and that similar suffering. It's really important that we run this virus down through following the rules that we have in place. We're confident we can do so, but that needs us all to continue to follow the public health rules, to get tested with even the most mildest of symptoms, to check in everywhere, every time that you go anywhere, to keep our public health officials up to date with movement data. And if you've got the opportunity to be vaccinated, please come forward and get vaccinated. There are still spots available in both the GP network and in our state-run clinics. I myself got my second AstraZeneca dose today down at the Melbourne Exhibition and Convention Centre. A seamless operation. I want to thank the Royal Melbourne Hospital team for their outstanding work down there. There are vaccines available if you're eligible, and as more vaccines become available to us, to our GP partners in the coming weeks and months ahead, please get vaccinated. It just gives us all that opportunity to live a COVID-safe future. I'll ask Naomi and then Ben to say a few words, and then we're happy to take questions. Thanks.
Thank you, Minister. The Public Health team is investigating the circumstances surrounding the positive case of the traffic controller, or the mystery case that came to light yesterday. Interviews were conducted yesterday and they are continuing throughout the day today, and we're really following up all of the possible sources of infection for this gentleman. We're investigating where he was during his acquisition period and where he worked and travelled while infectious. Testing is already underway, and several members of his household and his close social circle have already returned a negative test result, which is very encouraging. New exposure sites were listed on the website yesterday within a matter of hours, and they include the United Petroleum in Baxter, Chemist Warehouse in Baxter, Kooringal Hub Shopping Centre, including the Coles supermarket, Richie's IGA Liquor on Murray-Dark Freeway, Frankston, the 7-Eleven in Yarraville, and the Woolworths at Borwick Square in Altona North. We do know that the positive case worked at Moonee Valley Racecourse testing site, and that site remains closed today and will do so for a few days yet. A deep clean is underway, and details of when it will reopen will be made available online. Now, if you do live in that area and you need a test, the recommendation is to head to the Showground site. That's our biggest testing site, and they've got really fantastic capacity there. His various work colleagues have been identified as close contacts and they are being tested. He did visit his partner in Newport while he was infectious, and tests are underway for those people living in a low-rise apartment complex in Newport as we speak. We'll continue to provide public health updates and list additional exposure sites as we learn more about this case. Just want to talk for a moment about the Lacrosse Apartments that we've talked about quite a bit over the past week. We initially identified a positive case who lived in that building, and that person moved out to hotel quarantine. You'll remember that we nominated that site as a Tier 1 site, and there are around 500 PCCs living in that building. We set up a testing facility out the front, and we put various support services in place for those residents. We've also been doing wastewater sampling of that building, and that did uncover an unexpected detection, which resulted in some additional testing, and subsequently we discovered that the positive case's household contacts had also become positive. These cases have been isolating, and they are in the process of moving to hotel quarantine as well. It's really important that all residents in the building continue to remain isolated. We are supporting them with various concierge services, and we'll be providing in-reach testing, day 6 testing, to all residents in that building today. This is the largest in-reach testing response that we've provided into an apartment building. It's very, very difficult for those 500 people who are in that building to remain isolated, but it's absolutely necessary to make sure that they're safe and that the other residents in the building are safe, and of course that the whole community is safe. Now, they're not the only ones who are in isolation. We have many PCCs who are still completing their isolation period, as the Minister spoke to. Yesterday we cleared 3,600 people as primary close contacts. Again, that's the biggest day of clearing primary close contacts that we've ever had. We do continue to ask people for their understanding and cooperation in this significant process. There'll be many more thousands cleared today and over coming days. As the Minister mentioned, you do need that negative day 13 test. You'll get a phone call from us. You do need that written clearance from the department. We are clearing the close contacts as quickly as we can. It is a significant number. For those of you who are waiting, you'll get the call and we'll get you out of quarantine as quickly as we can. Thanks.
Thanks, Naomi. So this outbreak has shown us that everybody who can get vaccinated should get vaccinated. We've already seen Victorians come out in big numbers and we need that to continue throughout the winter. I think it's over 3.2 million doses administered in Victoria so far, 1.6 million of which were through general practice and the other half through the state system. In terms of those who are eligible, the Australian government has recently announced that people who are pregnant and aged 16 years and over are now eligible for COVID-19 vaccination. And Pfizer vaccine has been recommended by both ATAGI and the College of Obstetricians and Gynecologists at any stage of pregnancy. We know that contracting COVID-19 when having a baby presents additional risk, an increased risk of significant illness throughout pregnancy, and an increased risk of complications during the birth process. We also know from international research that these vaccines are safe to be administered in pregnancy and also safe during breastfeeding. Like any health decision, of course, we would always recommend asking your local general practitioner or healthcare provider for the advice that individuals need to make their own decision. If someone's trying to become pregnant, they don't need to delay their vaccination. People who are breastfeeding can have the Pfizer vaccine and don't need to stop breastfeeding after they've been vaccinated. So you can book now using the online booking portal, fill out the eligibility declaration form, which is linked through that portal, and then bring it with you when you come to be vaccinated. We do have bookings in the system for both Pfizer and AstraZeneca vaccines, including some first dose Pfizer vaccine appointments available. And specifically for people who are pregnant, Pfizer is recommended, and there are some appointments available also for other eligible members of the community. Because every dose of vaccine does make our community safer and makes our world safer. Today's cases remind us, as Minister Foley mentioned, that COVID-19 is still very much with us in the community. We've had some unexpected wastewater sample detections for COVID-19 in the Camberwell area from samples that were taken on the 26th and the 27th of July. So for people in the Camberwell region, if you have the mildest of symptoms, please go and get tested for COVID-19. That applies obviously to everyone elsewhere in Victoria as well. We've seen this virus transmitted within households, in restaurants, and in sports stadia. And that's why it's so important to follow the restrictions that are now in place. You can't visit other people in their homes. The Delta variant has already spread within households, and it appears the attack rate within households is actually higher than what we have previously seen. Just like the 2 positive cases in the Lacrosse Apartments that Naomi spoke to today. Masks must still be worn indoors and outdoors unless an exemption or an exception applies. It makes sense to wear masks. Masks protect us against this virus, and they continue to do so. They're an essential part of our response as a community to protecting ourselves against COVID-19. Victorians no longer need a reason to leave home, and I think we're all delighted that schools are open for children of all ages. But if you can work from home, you should continue working from home. No crowds are allowed at our sporting events, and everyone needs to stay COVID safe to help keep our whole community safe. Check in using the QR code everywhere, every time. Get tested, and absolutely please, when you're eligible, come forward and be vaccinated. And please think of this if, as I will be, you're catching up with your family and friends outdoors this weekend. Thank you. And I think now we're going to open for some questions.
Professor, we're about to lose you sooner. Can you start with you, if that's okay?
If that's okay, Minister.
On pregnant women and getting vaccinated, I think it was a month ago that ATAGI came out with that advice. Why the push for it now? Why are you now calling on people to get that vaccination?
So following ATAGI's advice and the advice of the College of Obstetricians and Gynecologists, it was last week that the Commonwealth Government included women who are pregnant in their eligibility criteria. So that's why now, as other states and territories, we're moving to ensure that that eligibility is reflected here in Victoria as well.
And some women are saying that they're hesitant to get it while they're pregnant and even while they're breastfeeding. Do you think the messaging has been clear enough that it is safe?
I think the messaging around safety in pregnancy has followed the evidence. And so as the evidence became increasingly strong from overseas, right from the start we were saying that vaccination is safe while breastfeeding and also for people who are planning pregnancy. Then as increasing evidence showed that vaccination is safe during pregnancy, that's why ATAGI and indeed the College of Obstetricians and Gynecologists have made this move. So we've really been following the evidence, and now's the time that obviously ATAGI, the College of Obstetricians and Gynecologists and now the Commonwealth have brought forward eligibility for women who are pregnant.
And I know it's very early days, but do you have any figures or even anything anecdotally to know about how many pregnant women are taking it up?
I really don't at this stage. It's certainly something we'll be watching. We'll be able to reflect those data because we'll be capturing the eligibility of pregnancy as being the reason why people are being vaccinated. So we will be able to report those data as it starts to happen.
And is there any final message that you would have for women who are a bit worried, who think, oh, it's too early, I'll wait and see what other people do? Any message to get them to take up this opportunity?
Of course. Look, I guess I would reflect on the fact that our leading experts in both vaccination and our leading experts in the health of pregnant women have both come out saying this is a good thing to do, that whilst in absolute terms the risk of COVID-19 for otherwise healthy women is relatively low, we do know from international data that being pregnant does put you at an increased risk compared to someone who is not pregnant of the same age. And so therefore, this is why these recommendations have come out. Like for anybody, if you've got concerns, if you're not sure about your own personal status, please go and speak to your GP or other healthcare provider, and they will give you the expert advice specific to your circumstances.
Professor, in terms of this Moonee Valley case, have you seen anything so far that suggests we're going to need any more additional restrictions to what we have already?
So the restrictions in place are already protecting all of us. We've talked about the importance of masks. We've talked about the other restrictions such as not visiting people in their home, etc. So whilst we are moving back towards COVID normal in a very steady and measured way, that's why we are taking those sort of slow steps back for this exact reason. COVID-19 is in our community still. There will be further cases that pop up in coming weeks and months. There will also be further incursions from potentially interstate, depending on what happens. We need to be prepared for that. So I don't see any reason why in the short term our restrictions will change on the basis of this individual case. We really do need to be, although we all need to be following the existing restrictions to keep us safe while we manage these through our contact traces and other sort of responses to individual cases and to those exposure sites.
It's obviously positive signs that his household contacts have already returned negative results.
Yes.
Do we know whether he was vaccinated? Has that contributed to less spread?
So the actual index case, whether they were vaccinated or not, my understanding at this point in time is that person was not vaccinated, but we're still clarifying those facts. But at this point in time, there's no evidence of vaccination.
And his partner in your body, she returned a negative test?
Yeah, that is my understanding, yes.
Is it a requirement for him to be vaccinated if he's working around testing centres?
So as a person working in a testing centre, all people working in those testing centres are eligible as frontline healthcare workers and have been eligible for vaccination, indeed, since the 22nd of February. I think whilst as we've been saying, and Minister Foley mentioned earlier, and as I just reiterated, everyone who is eligible, we ask them to come forward and be vaccinated as soon as possible. For high priority individuals such as healthcare workers, they have prioritised access to vaccination. They can book in right now. So we certainly strongly encourage all frontline healthcare workers, including those at testing sites, to come forward and be vaccinated.
Do you think it's disappointing that this person perhaps was not vaccinated when they were eligible and were working in these areas?
Oh, look, I certainly feel that this is such a fundamental part of our own protection as a community, as all healthcare workers, and I would call on all healthcare workers to please come forward and be vaccinated. This is an essential part of protecting ourselves, our colleagues, and indeed our patients. So it's a really important measure we can take.
Is there any other lines of investigation to suggest that he didn't catch it at work?
So we're not absolutely certain of the source of acquisition. There's a lot of investigations going on, as Naomi was mentioning, exploring all of the possibilities of where this acquisition occurred. We're taking a very precautionary approach in furloughing and testing a number of staff and really investigating whether this was indeed an occupational exposure or an exposure in the community. So all of those options are being further investigated as we speak.
And have there been a positive case picked up at that testing site on any of those days that you were able to find that out yet?
Yeah, look, I understand, yes. On the days during the acquisition period, there were some individuals who subsequently tested positive. I think it's an important point that this individual was not having really close direct contact with people coming through those testing sites. As someone who was assisting to direct traffic, really limited contact with individuals attending for testing. But that's obviously an important point, and was wearing appropriate protective equipment at all times, of course.
So what's the status of the Newport low-rise? Are they locked down, or are they waiting to find out how long they'll be in quarantine for?
So I don't know if Naomi has more details on that. Thank you. Thanks, Naomi.
Thanks. So it's obviously a pretty emerging situation. So everyone who lives in that low-rise complex will have received a phone call this morning, and we're in the process of getting them all tested. The assessment in terms of what the status of that complex is going to be going forward, and therefore what the requirements are going to be for those residents is happening as we speak. So more information will be coming through to those residents right now and over the coming hours, and obviously once that information is available, we will make it available to the public.
There seemed to be some confusion even this morning. Some people who lived in the block seemed to think they're in lockdown, others were walking out and going to the shops and coming back in. Should there not be some kind of uniform messaging there so that either everybody's in or you're free to go out?
I think the messaging probably has been uniform, but obviously as that messaging is happening progressively, as different people are being contacted at different times, there might be a bit of sort of confusion in the very early stages of that. But my understanding is that everyone in the complex has now been phoned and provided with direct instructions. We're getting them tested. And in terms of the status of the building and the status of those individual residents, and indeed in terms of the support that might then be required, depending on what we're asking them to do, that'll be being made clear to them right now and over the coming hours.
And you might have mentioned this before, sorry if you did, but is there a constant health department presence there today? Is there testing happening on site, or is there officials from the health department there?
Yeah, so there will be people down there, and depending on what happens with the building going forward, those support structures will either be in place in an ongoing way, as they have been in other complexes. It really depends on what we find this morning and what's determined in terms of the status of that building.
Are there any other apartment blocks that have been put into isolation today? Suggestions as well in Hawthorn potentially?
Yeah, I think there is a complex in Hawthorn where the status of some of the residents might have changed. Again, that's literally happening as we speak, so I don't really have any more information, but I do understand that some of the residents in that complex might have received some updated advice and information this morning.
Do you know why that may be the case? What could change that?
I really don't have that information, sorry. It's literally happening as we speak.
Can I also ask you about the Balmoral Apartments in Hawthorn? Is that going to be upgraded or downgraded?
We'll have to come back and clarify that with you. So it is literally sort of happening as we speak. Yep.
South Australia is still a red zone. They haven't had cases in a while. Do we know when that is likely to be downgraded?
That might be a question for the
Sure.
acting.
Thank you. Yep. Thank you. Yeah, I don't have any further advice on that at this point in time. Obviously, our permit zones and the areas are reviewed on an ongoing basis, weighing up, yes, indeed, the local epidemiology, which is looking reassuring in South Australia, which is fantastic. we're all really happy with that. So that's reviewed on a daily basis. It also relates to the current restrictions in place in those jurisdictions, and we follow their lead. In about 10 minutes, I'll be in a meeting which includes our South Australian colleagues, and I'll be getting an update then.
Just on the traffic controller, has genomic sequencing been underway, and do we believe he's got the Delta variant?
So on the basis of likelihood, it would be the Delta variant, considering that's what's been circulating here. Genomic sequencing is indeed underway. We do not have the results of that at this point in time, but it's being made a priority for obvious reasons.
When do you expect to get them? Like the next day?
Look, I'm not sure when it was actually referred through to the reference labs, but it is being expedited at the highest possible speed. You can understand we're very keen to find out further information on that too.
And how detailed can that genomic sequencing be? Can it link it to an individual person who might have been at that Mooney Valley Centre that day?
It's a great question. Because we have quite what's termed a clonal population, so all of these cases have come from the same source virus in the current outbreak that obviously represented an interstate incursion. They're all highly related to each other, which makes it more complicated to try and identify those linkages between two individuals. It may be that even with the expertise and the analysis of these two, that isolate and comparing it to other isolates in Victoria recently, we may not find the smoking gun, so to speak, about who indeed was where that transmission occurred. But it's part of the supportive evidence, and we still use traditional epidemiological methods and reviewing other sources of information to try and make a place and time connection. And we've got contact tracers who are expertly reviewing all of that evidence as we speak.
So is it possible or even likely that it'll just show it's a Delta variant that started in Sydney, or can we get kind of beyond that?
There's usually more discrimination than that, certainly compared with cases that are not part of that same sort of closely related group. It also relates to how much signal there is and whether they're actually able to amplify enough of the virus to be able to do accurate sequencing. So there is quite a few variables involved, but we've got a huge amount of experience now doing this and adding this sort of virological investigation to the traditional epidemiological investigations. So as soon as we've got more information, we'll certainly share that.
And from your interviews with the traffic controller, has he told you that he was wearing, we know he's wearing PPE, but has he said that there was any stage that he might have taken it off or might have
Yeah, I'm not privy to that sort of information, and it's sort of individual level information. Certainly, I mean, the training and the ongoing compliance with PPE use at all of our testing sites is a real focus. So, and we've got fantastic healthcare workers working in those sites who would no doubt be reminding everyone on the optimal use of PPE. No, I'm not aware of that.
The Premier tougher border restrictions again with New South Wales. They've had a pretty horrible day
Yeah.
today. Is that on the cards?
So in terms of how we relate to the border restrictions, I mean, obviously, as we said before, we're reviewing all of those settings on a daily basis. We already have very significant restrictions in place, and a lot of enforcement and of the compliance with those is ongoing. But, you know, we obviously continue to review the situation, not just in New South Wales, but nationally on a daily basis.
I didn't hear the first part of the question.
Yeah, so we've been told there's a family of 5 in the eastern suburbs. 3 are positive and 2 are negative. The negative ones were told 6 days ago that they'd been moved out of the house. What's the delay in that?
I'm not briefed on that particular set of circumstances, but I'm happy to follow it up. Presumably they're part of the, so far, if it's been recent days, over 20,000 plus primary close contacts who are isolating. If there's particular issues that we can respond to that, I'm happy if you can share them with us. They might well already be engaging with our teams, but I'm happy to follow that one up.
Gladys Berejiklian says that New South Wales has harsher restrictions than any other state has ever had. What would your response to that be?
Oh, look, New South Wales restrictions are a matter for New South Wales. We'll continue to lend support wherever we can. Victorians know what harsh restrictions look like. The Premier's gone to this issue a couple of times. I'd refer people to those comments about some of the learnings that we can offer to share with, and have offered and have shared with New South Wales, but it's a matter for New South Wales to take those up.
What's your reaction to the fact that we believe this traffic controller was unvaccinated but yet was eligible?
Look, all of those groups of priority workers who are eligible, whether they be nurses, whether they be ambulance, Victoria staff, whether they be Victoria Police and other frontline workers, we encourage them all. The people who are obliged to be vaccinated are our hotel quarantine staff, and we're going through a process as part of the National Cabinet decision of making sure that residential aged care staff have to be vaccinated. They are the two groups that are in the must. All the other groups, in particularly 1A and 1B category, if we can cast our mind back to the start of the year, we strongly encourage, we strongly facilitate, we give the opportunity for priority access. And can I just use this as an opportunity to reinforce again, if you're a frontline worker, if you're eligible, if you've been eligible, let this be a clear moment of reflection. Let this be a lesson. Get yourself vaccinated. The opportunities are there now. The opportunities are there through the GP network or the 50 plus state-run clinics to get yourself vaccinated. It keeps you safe. It keeps those you love and live with safe, and those that you share your community with safe. It's really important.
Is there nothing more you can do other than strongly encourage frontline workers?
Look, under the current national framework and how we apply it in Victoria, we'll continue to strongly encourage that. Clearly, as more vaccines become available and as so many people come forward, there was a really strong crowd of people down there this morning at Jeff's shed in the AstraZeneca line. The AstraZeneca line was twice as long as the Pfizer line this morning, I'm here to tell you. And that shows to me that there is a strong view amongst Victorians that they want to get vaccinated. For those people who haven't and are eligible, please just reflect on what's happened here and use that as an opportunity to make your decision to come forward and get vaccinated. You're eligible, it's there, please come forward and get vaccinated. Anything else? Thank you for your time, and I'm sure we'll talk soon.